the Health and Human Services and Veterans Standing Committee to order. We are going to start with our Pledge of Allegiance. I do see that Mr. Seep is online. Are you able to lead us in the Pledge of Allegiance, Supervisor Seep?
Yes, thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, do we have proof of notification? So before we approve the agenda, I was notified that we need to strike number 14, approve the finalized community health needs assessment from our agenda. That is not ready yet. So with that in mind, I would take a motion to approve the now 20-point agenda. Thank you, Mr. Renish. Second by Mr. Van Landijk. All those in favor, please say aye. Aye. Any opposed?
And Madam Chair,
Yes, Mr. Seep.
I don't see roll call on the agenda. Would you mind taking a roll call of the members present?
Sure, that's fine. Are you able to do that? Oh, Megan can. Okay.
Okay. Carrie Severson. Danielle Rudersdorf.
Present.
Ingrid Glassbrenner.
Here.
Timothy Gacho.
Here.
Donald Seep.
Here.
Ken Renish. Dr. Gerald Barris. Cindy Chicker. Sherry Hilsheim. Lee Van Landwit.
Here.
Francis Brathwaite.
That takes us to number 5, approve previous meeting minutes. Does anyone have any comments or changes to the previous meeting minutes? Thank you, Mr. Renish. And a second?
Meeting is not started yet.
All those in favor, please say aye.
Aye.
Any opposed? Okay, that takes us to our public comment portion. Did we have a sign-in sheet? Oh, okay. Thank you, Megan. So before we get into our public comments, I just want to thank you all for being present here, for caring and coming to share your voice on issues that concern you. I did want to just let you all know that as we go into the discussion, I'm going to assume most of you are here in regards to the nutrition and food service. When we go into our discussion, which is a little later on our agenda, you know, we're going to be focused on the program itself, the food service, what's best for the food service, and not individual job performances or anything like that. So while this is public comment and I can't restrict you from saying things, I would ask that you take that into consideration and keep it focused on the matters in hand and not on personal anything like that. So what we're going to do is I'm going to go from what is signed up on here. So we'll go down the line. We'll try to keep it to approximately 2 minutes just so we can get through everybody and still have a timely meeting. We have a lot on our agenda. So with that in mind, it looks like the first person, Karen Hardy, it did not mention whether you wanted to speak. Did you want to speak today? No. Okay. So Angela Metz. Hi. Oh, I'm sorry. We'll have you come up and use a microphone, please, so those online can hear.
Before, but I was so moved to so I've not done this before. I was so moved to come in person to speak to this body, and I've prepared a little statement. So my name is Angela Metz. I'm a member of the COAD board, former county employee, long-term county resident. I'm here to show my support for the members of the Richland County Health and Human Services staff that were present yesterday, along with the other board members that were present at the combined COAD and NAC board, who I feel in all sincerity were subjected to some unkind and, in my opinion, intimidating comments that I found hurtful regarding the very difficult decision that was reached in voting to support a particular food service provider for the senior nutrition program. I want to say the board is made up of kind, caring, and thoughtful people who simply try to do their best for our community. And I have great respect for the employees of that building across the street where I used to work. And I'm just saddened by what occurred yesterday. That's all I have to say. Thank you.
Thank you, Ms. Metz. I'm afraid I may not pronounce this correctly, but Mary Rondeau? Rondeau, okay. Barb Wentz.
Oh, thank you. Yes. I was one that spoke yesterday. My name is Barb Wentz. I've been Assistant Dean for Administrative Service at the campus for 42 years. I guess I was very upset yesterday because I don't think the full story was told. And I'm just going to say this, that when bids are open, when I was an assistant dean, they brought the bids to the committee and let them review it. Not just copies that they wanted us to see. Because we weren't told. Does Mazomani, that's one of your, who got the bid yesterday, by the way. Mazomani, did they have a backup plan? If they couldn't get the meals here? Nothing. Nothing was said. Linda Gentis can give you more details. They have a plan. The campus food service or county food service, I gotta quit saying that, because they are county employees, 2 of them. And they also just got what I used to call a green thumb person to help them out. So they're doing a great job. I would like you to hear, a lot of the people are happy with them. I don't know if Mazomani, if they don't come, do the elderly not get their meals? That wasn't pointed out, and I hope it will be today. I was also upset because it's probably over a $50,000 contract. What is our logo in Richland Center and Richland County? Let's support local businesses. This board that was there yesterday, we didn't get to talk to after the vote was taken. I was surprised about that. At least this board has us talk first before you vote. That was another issue. And it was brought up when this before, and I'm just going to say the names because I don't have a problem. Tricia Clemens was asked to put on the last board meeting about the bid that was previously. That was not on your agenda. And I know board members asked for that. And then they said, oh, when she talks, I was there, by the way, she will let you talk about it. She didn't allow it.
Barb, I'm just going to insert that it's been about 2.5 minutes so far.
Okay, I'm just saying, please support the campus. We have had some bad, we have Plan B, and I want you to know we're going to be open. We have things ready. We have backup, Richland locker plant if something happens to one of the freezers. We also have the Richland Hospital to back up for meals. So I'm asking you, don't worry about it. We didn't miss one meal since 1987, even through COVID. Thank you for letting me talk.
Thank you, Ms. Wentz. Linda Gentis.
Hi, my name is Linda Gentis, and I'm Chair of the Richland County Education Standing Committee, which has the oversight of the, I keep running to say it, is not the campus food service, is the Richland County Food Service, and is separate from the campus completely in that regard. Okay, so I also was at the meeting yesterday, and I also realized that one of the problems here is that we all care a lot. I know the staff cares and we care, and we're all caring and making some contentious because we care so much about the nutrition program and about all the factors about it. I was disappointed yesterday that they didn't open the bids and have a quantifying of the bids like they did for official RFP. And that they didn't look at each bid and compare them, and what they had done previously with the new bids, they didn't do that. They have a backup plan with the hospital. And this is the Richland County Food Service, and they could work out a plan for delivery if that was needed. The directions on the RFP stated that delivery was not necessary, but the form mentioned that doing delivery. This was confusing and very contradictory, and it was difficult to figure out how to put your bid forward. The email sent on June 1 asking for the breakdown of food items said they wanted that from the successful bid. They didn't ask for that on the bid. I've been in contact with Crawford County, who's been working on a sustainable and local healthy foods. I also talked to Sauk County, Meg Allen. They are not pleased with their menus. It is done by Cisco, and they would like to be more nutritious. They would like to work on the menus. I'm trying to contact the menu maker for Crawford County because she's doing a very healthy menu. And the Mazo Deli now is getting their menu from Cisco. So it would be good if all three counties, no matter how this turns out, if all three counties could work together and figure out a healthy, good menu that has local foods in the summer and whenever they can. Currently, since January, the Richland County Food Service is in the black. Stephanie Derry took her position in October and reorganized the purchasing to get the finances in order. They had some problems during the COVID and Platteville removing the summer programs, but they have reorganized and now are doing okay. And during COVID, as you know, the Richland Food Service kept the meals and nutrition program going, even though the community center was closed, and they have not missed a meal in 30 years. Every year, their contract is negotiated.
Ms. Gentis, you're at 3 minutes.
I'm going to be very short because this is very important. What I think would be of interest if you read the bid from Mazo is that their truck with the senior meals leaves at 8 a.m. This means if you have food such as a hamburger that was served last Friday at the meal site, they would be prepared by 7 or 7:30. Then needed to keep warm and moist for 4 hours before it would be served. This would definitely be a problem for vegetables not getting too soggy, and I worry about the food being kept at medium temperatures for so long. This also means that we do not know the route Mazo would be taking to Richland Center. Will it come on Highway 14 or will it come from Baraboo across country? Roads can be tricky in the winter. Thank you.
Thank you, Ms. Gentis. That takes us to Christy Thompson.
Thank you. I just want to say that it seems a bit disingenuous that you want to farm this contract out to another county when we're capable of handling it here within our county borders and have done so for years. It's easy to say it's only 2 people at that campus kitchen, but there are 2 people and it's money that stays within this county. If you are going to say that that's not important, I don't believe that. And I think that you make people believe that you really don't understand how many people in this county feel. As if we are not being listened to, and as if our opinion doesn't really matter. I don't think you want to make us feel that way. But it is what it is. There's nothing I can do to change your opinions except state mine. Thank you.
Thank you. Larry Engel.
Good morning. I'm Pastor Larry Engel. I was at the meeting yesterday as well, and as a member of the Commission on Aging and Disability. Now, I'm the one that made the motion to approve, and I had 4 reasons for doing that. The first one was the vendor was unanimously recommended by staff after extensive review. We have excellent staff, deeply committed to the agency mission. The commission then reviewed the recommendation, heard the different arguments around the county kitchen and the Maysville proposals, looked at our mission to ensure quality nutrition services, and passed the recommendation by majority vote. Third point, uncertainty on the future of the campus was both acknowledged, considered, and worried about during the discussion. It's a creative and unease in tension. But to be clear, that's a separate issue. The fourth reason was retaining and recruiting county staff has been and is challenging. We have excellent staff, clear on mission, professional, thorough in their work. So the staff and the commission recommends.
Thank you, Mr. Engel. Is there anyone else from the public who would like to speak, or anyone from our committee who would like to speak as a member of the public?
Madam Chair.
Yes, is that Supervisor Seep?
Yes, thank you. I am not a member of the Commission on Aging and Disability, nor am I a member of the Nutrition Advisory Committee. I had served on the Nutrition Advisory Committee in the past, and I very much value the service to our senior citizens. I don't want to waste a lot of time here, but I wanted to ask what will happen to the positions that apparently will be eliminated or put aside as a result of the potential action to go with Mesa Maney.
I'm not sure I understand what you're saying, as we don't.
Has there been any discussion about what will happen to those two positions? Will they be vacated?
I don't think that would be pertinent to our discussion because we are not responsible for that particular department. So I believe, I mean, if that were a question, I think you would need to speak to Mr. Hokumer about that.
Is Mr. Hokumer present?
He is. Did you want to address that?
John, would you mind commenting on that?
Certainly, and no decisions have been made at this point, but I would say that is part of the budget process, and the county board would need to consider that during the budget process and what is prepared and submitted to them. So, again, at this point, there have been no decisions made. We don't know. We don't know. We still don't know the future of the campus. We're continue to have conversations with the campus, and so I would just repeat it. That will be part of the budget process.
Thank you, John. So,
Madam Chair.
May I continue my question?
Yes, if it can be brief.
Well, I always try to be brief. If I'm not, I certainly am abbreviating.
Well, I'm just trying to keep you to the same standard as everyone else in public comment.
Thank you. John, are you implying that that this decision, not having been made yet, will finally be made after the budget is prepared?
I think that if the contract for the nutrition meal changes to a different vendor, then certainly the county will have to have a conversation regarding the future of the food service on that property. And again, there's so many unknowns at this point that we don't know. We don't know what the future will bring on that, but that's not a decision that this body will make. If there is a change, with those employees and their employment or food service in general, that will be taken up by the county board.
And the ultimate decision about the which vendor will be selected will rest with the county board? Is that correct?
Supervisor Seep, this is Trish Clements. I just want to let you know that what'll happen is the contract, because it is over 50,000, will go to the full county board for their approval.
Thank you, Trish.
Okay,
I'm concerned about the many unknowns at this point.
Mr. Seep, could I just say, we are going to be talking about this during the actual agenda item, and we can have further discussion at this time, but public comment is typically not for question and answer format. So I'm gonna switch over to Supervisor Renish, who had a comment.
Yeah, I just wanted to say, being on the Pine Valley Board of Trustees, I think John would agree that everybody here is concerned about employees. Number one, we can't get them, so we surely don't want to lose them. So I think everybody would agree that an interdepartmental transfer could be done and highly recommended to a quality employee. So it's not like we're kicking people out the door. There's places they can go.
Okay. I'm going to then declare, if there's no one else, this public comment portion to be done. I want to again thank you to those who have shared and who are attending. We do have a few agenda items before we get to the actual discussion on this topic. So that takes us to number 7, the 2023 VSO budget summary. Ms. Knock did let me know that she was not able to attend today, as she and her other staff member are attending their annual conference in Madison, I believe. But we do have her budget summary in the packet, and if anyone has questions, we can have that addressed at the next meeting. So unless there is something pressing, I'm going to move us then past number 8 as well to number 9 through 11, the consent items. We have the HHS expenditures report, the budget summary, and the contract monitoring report. Did any staff members want to make any comments about any of those? Stephanie, I don't know if you had anything in particular. I think I had a question on something, but I'm going to have to look at it. Anyone else on the committee have questions on any of those consent items? I think my question was in regards to number 11, the contract monitoring report. There were a few on, I think it was page 5 in particular. I was looking at like Cholita and Forward Home, and I know they're not much over the percent utilized. I was just curious, and this I assume would be a question for Jessica Tisdale. Is she on?
I am.
Oh, hi. I assume both of those are ones that we've used frequently in the past. I remember them being on our
Yes.
contract monitoring. Are you
So they're
concerned at all?
carryover ones. I think our Cholita one should be good. That youth will be aging out of care later this year. So that one will be good. Forward Home, I'll continue to assess for it. The difficulty with establishing the children's contracts is that our rates are not given to us. They're state set rates. They're not given to us until approximately December. So all of our contract information has to be started much before that. So sometimes we're a little bit off if there's significant increases. So we'll continue to monitor that Forward Home one and do a modification if we're running close to that at the end of the year.
Okay. I guess I had just been curious if we were utilizing it more than normal this year.
No, they're both one individual at both agencies. Again, it's just because the state takes so long to issue the
Okay.
state identified rates. So the contracts are due before those rates are set. So we do our best guesstimate as to what those may cost us for the upcoming year, but usually don't know until they issue the rates.
Okay. Thank you.
Yep.
Does anyone else have comments or questions? Yes, Mr. Renish.
On the building and operating costs, we're at 54.8%.
Which
Is
one
that,
is that on?
is that because of a project?
The budget one?
I jumped ahead, sorry.
No, you actually went.
You're at 54.8%. Was there a major expense that took place, or is this a planned repair that we had done?
But it's higher. It should level off the rest of the year. I can double check the details in it, but that we have to pay our workman's comp and all those different liabilities at the beginning of the year in January. So that's a really big hit to that particular line. So
Okay, so you had that under operating costs.
Yeah,
Okay.
that's under operating costs. So
All right.
And I assume, as a similar to last month's. The reason why we're underutilized has been staff
Correct.
shortages. Okay.
Yeah, staff shortages, and as you know, we're not filling positions and things like that, so that'll definitely impact it.
Okay.
Mhm.
Okay. Then that will take us to, number 12. Mr. Gottschall, are you still online?
I am, yep.
Okay, and you had told me you needed to step out from, what was it, 10 to 10:15?
That's correct, yep.
I'm wondering if we should postpone until after 10:15. Is that okay with the rest of the committee? Because I would like Mr. Gottschall to be present for this discussion, and I don't think we're going to get through it in 4 minutes. Okay, so if there's no objections, then we'll go down to number 13. Approve HHS contracts, agreements, and amendments.
And we'll have to skip number 13 because the contract
Oh,
for the
right.
RFP will be
Okay,
there.
my bad.
Okay, that's okay.
So number 15, approve appointment of the local health officer position.
Right, so this is an exciting one for me. Rose left, which was sad, left us in January to retire. And Brandy Anderson has been the interim public health officer. We, through in an interview process and vetting with the state, are passing on the recommendations that Brandy Anderson become our public health officer, our permanent public health officer. So that needs to get approved by this committee and then approved by the full county board. So I am coming to you asking for the approval to appoint Brandy as the public health officer.
Kerry Severson will move for approval.
Yeah, could you give us a 30-second story of your life?
Not like putting you on the spot or anything. Before she does that, could I have a second? Thank you, Chair.
Start the clock right now.
Thank you. So I'm Brandy Anderson. I've been a public health nurse for on and off for about 6 years. I've been a nurse since 2001. I started my career here in Richland County. I worked for the Richland Hospital for many years. I have a pretty, I would say, very varied nursing background. I've done acute care, I've done home health, hospice, public health. I was the county psychiatric nurse for a couple of years over at HHS, and so I'm grateful that I'm being considered for this position, and I know it'll be a lot of hard work and challenging, but I'm willing to do my best, and I've had a lot of help thus far. So I'm very humbled and grateful that you're considering me for this. Thank you.
Thank you. Great. Are we ready to vote? All those in favor, please say aye. Aye. Any opposed? Just want to say thank you, Brandy, for being willing to join us. We're excited to have you.
Thank you.
Administrative report, Director Clements.
Okay, so I did a little something different this month. With the unit updates, I did give them and provide them in the folder in writing. Typically, I sit and I read these to you. So I didn't know if it would be okay if I just did it in writing, provided to you, and then if you had any questions, we could have some discussion in regards to that. Or if you want me to read, I'll read to you.
What are the committee's wishes? I did read through it, but does anybody need her to read it through to us? Or have questions?
Across the street, the building's not on fire, so we're good.
We're good, that's right. Other updates that I do want to let you know is the community health needs assessment, and the chip should be to us any day now. We had our final email, I believe, with them Tuesday of this week, just confirming all the final edits. So we are hoping that we have it to you really soon. I had hoped it would be ready for today, but that'll be an exciting time for us then to start getting rolling with that and getting that going. Just a follow up on the public health nurse issue. We have not had any applicants. We've had a couple of kind of reach outs via Indeed. Wages has been a struggle like that. Some have said we're not going to waste your time if the wages are non-negotiable. But we did advertise it at the step 4, like we talked about, tried to highlight some of the other perks of the job. And I do intend, if we continue to strike out there, to start the process to look into a public health specialist instead of the public health nurse for one of the positions. But I think those are the main updates that we have in regards to that for right now.
Madam Chair.
Oh, yeah, that's the other thing I forgot.
One moment, Supervisor Seep.
Forgot to share. UW Extension staff, 3 of their staff will be moving into the Community Services Building next week. We've been doing some work to get their offices ready and get everything set up for them and making sure everything is really ready to go. So we're excited for them to come in.
Can you remind us again, what area is that going to be?
It's in the old ADRC area, if that helps anyone. So it would be on the southwest side of the building, right next to the behavioral health clinic.
Okay.
Yeah. So they'll be right next to like the copy area, which it sounds like they do lots of work using the countertops, the break rooms there, the bathrooms are right there. And so they will have that area.
Okay. All right. Thank you. Supervisor Seep.
Yes, I just wanted to comment that I very much appreciate Trish submitting written reports. I think that's very helpful.
Thank you. I got the idea from the interim administrator. He did that at the last county board meeting, and I thought that was a great idea.
I appreciated it as well. Thank you.
All right, thanks.
Okay, that takes us to review the 2023 HHS annual report, which is in your packets, number 17.
So again, this was provided last month, and then it's in there again. Just wanting to see if you guys have any questions, comments, concerns in regards to it. As you can see in the end, we did come in under budget, which was good. Again, staff shortages was a big part of that reason. But if there's any questions about the report, I or any of the managers could answer those.
I just realized it says 2023, but it should say 2022, correct?
Yes.
Yeah. Okay. Again, I just want to say I appreciate you guys putting this together. I've always looked forward to these reports because as committee members, I just think it helps give us a broader overview of everything that you guys are doing. It's complex. So this is a great resource to understand what you guys are doing and all the hard work that you do. So thank you to all of you. And thank you for, I know this is a lot of work just to put this report together. I mean, it's 63 pages. So thank you again. It's a great picture of the services that you guys work so hard to provide.
And I will commend the managers and Megan for putting it together. The managers do all the work in regards to their section, and then Megan does a great job of putting it together.
Committee members, did anyone have questions? Hopefully we had it last month, so hopefully you guys all had a chance to review that. Joanna, are you coming up?
I just always gotta say something smart, so. For us people that served in the Marine Corps, thank you for the pictures. Easier to understand.
You took the words right out of my mouth, literally.
Graphic.
I think, sure, Madam Chair.
Yeah.
Right on the first page is like 6 or 4. Nutrition Advisory Council's got Don Roseberry listed as the chair. I believe he passed away last year.
But at what point? Because if he would have been chair for part of the year?
Yeah. But who was on our board last year left, and there was nobody.
All right. That takes us to 18, the review of the updated organizational chart. Is there someone who will actually walk us through kind of what's changed?
Yeah, I can walk you through. And
Sorry, before you went, I just wanted to ask, because this looks a little different than the past. You guys have updated it. I like it. It's clean and easy to read. I'm just wondering the different colors. I didn't see a key necessarily. I mean, I assume yellow obviously is like department heads, but are purple like lease staff? Oh, sorry.
Yes, I can speak to that. So
Okay.
yellow is going to be anybody technically in the management category.
Okay.
If you flip to like the second page, I think there's kind of some examples. Yep. So your light green shade, those are going to be any part-time leased staff that we have. The pinkish color, those are going to be any kind of temp casual people that we have. They're technically county employees, but they're temp casual people who only work, they're not a set number of hours a week, typically less than 17 hours. I think, and then the purple colors, if I think behavioral health has several of them, Jamie. Those are going to be people that we contract with. So such as our psychiatrists, our nurse practitioner, those types of people that we have contracts with to come in and provide services.
Thank you. That helps.
So on the first page of the organizational chart, that's just an overview of the whole agency. So thus far, we haven't had one picture that kind of covers every single position within the agency. And so I wanted to have that quick visual of being able to see where everything is, who's there, how many of each different position. So really tried to clarify that there. As we went through and updated this, we really started to take a look at who are the staff that we pretty much who do we have on the staff authorization chart as employees within HHS. So we have had some positions over the year that the staff authorization table does call it a 0, but they are listed as the number of or as an employee of HHS. For many of those, it had been many years that they have remained vacant, and so we did get those completely removed from the organizational chart. Really wanted to just have a good visual of what do we have, who are our staff, where are our holes, what do we need to fill in to try to make this work. Any questions on any?
I guess for me, I don't know, are you planning to go through each one individually? I could wait to ask or?
Yeah, I could do that if you want. I didn't
Okay.
know what you guys would want. So we can start with the administration and building operations. One of the significant changes that we've had in that unit is we did have the financial services unit, and then we had the administration and building operations unit. With the leaving of Angie Reisner, we have combined those two units, and they are now all supervised under Stephanie. So that's one of the major changes that we've had in the last 6 months. We do have a vacant secretary position, and that's up at our front desk. That's one that we're really trying to figure out, can that be one of the 5 that we have to cut? Because just as a reminder to everyone, when we went through the whole referendum process, there was the ask of us and the mandate at the end still that we have 5 positions that we need to cut through HHS by 2027. We don't want to jump the gun and eliminate it immediately because we really want to see, can we have the front desk manned with 1.5 staff? And so that's what we're doing right now is we have Annalie there full-time, and then Sherry is there a half a day every day. And so for right now it is working, but we just really want to confirm that that's something that'll work in the long run. Any questions in regards to that unit? Oops, I'm going away. Next, we have our Aging and Disability Resource Center. Right now, that unit is fully staffed, which is wonderful. The biggest change that we've had in that unit is our nutrition program did move from the public health unit into the Aging and Disability Resource Center. This is pretty typical. Most nutrition programs are in the ADRCs throughout the state. I think we were maybe one of the last standing ones that had it outside of the ADRC. So that was official as of May 1st. And so far, that's been a good transition. It's been very helpful, and it's really logical. Roxanne oversees all the oversees the financials for all of the aging programs. And so to oversee the programmatic part of the nutrition program makes a lot of sense. Any questions in regards to the ADRC? All right, next we have our behavioral health unit. As you noticed in my notes, Brandy Christensen as of Monday will be our permanent behavioral health manager. So we're really excited for that. A change with that is we did take the clinical supervision out of that position. That was a change that we made in the last couple of months and approved by the full county board. We do have some vacancies there that we are really working to fill. So with Brandy moving into the manager, that leaves the treatment court coordinator position open. Until that gets filled, she will be doing both roles. And we had a mental health case manager that will be done at mental health case manager position that's open, but also a mental health therapist position. Danielle Relke did give our notice and she will be leaving at the end of this month.
Trish, I do have a question on that.
Yeah.
On the vacancy on the treatment court coordinator, have we finalized a plan now between public safety and this committee? Everything, you know where I'm going with this.
I do.
So do we have a plan?
Last discussion that the judge and I have had, and Jennifer Harper was also there, is that it will remain under HHS. We did talk about, there is a match that needs to happen with that program, either through in-kind or through cash match. And we talked about to maximize that match, it is better for it to be in our office versus with the judge's office. So for right now, it is staying where it's at. When we do interviews and everything, the judge will be a part of it. She's been a part of updating policies, plans, procedures, all of that she is aware of. And so we've been having a good partnership working together. Yeah.
Can you remind me again? So I know we said we removed the clinical supervision. We were asking another county, was it, to look or?
So
I'm
through,
sorry.
no, that's okay. Clinical supervision, there's a couple different aspects to it. Number one, through the CCS program that is being completed by Trailhead. So they do some of our service facilitation. And so Chris Ruder is very well versed in the program and understands the program. So he is doing the clinical supervision for the CCS program. For our mental health
Is
therapy.
that considered leased then? Sorry to interrupt.
Contracted.
Contracted.
Yeah.
Okay.
Contracted. And then for our in-house mental health therapists that need that clinical supervision or some of the plans through crisis that need that is being provided by Dr. Tranel, and he's somebody we had anyway that we're working with. And then the final day-to-day supervision that may be needed in regards to crisis would be Northwest Connection. So they have master level therapists that are on call 24/7. And so we have been utilizing them when we have okay, here's a situation that we're in the moment right at this moment and I need to talk with somebody. They're doing that for us.
Okay. Thank you.
Mhm. So next we have our Child and Youth Services work unit. There is a vacant family preservation worker position. We've been really struggling to get that filled. We've interviewed a couple of people. First person turned it down. Second person said they would come. And then right before they were supposed to start, let us know that they weren't going to be able to come. So we are trying to expand the advertisement that is one through Southwest. And I am hoping through this next budget cycle that we can make it a county employee. And so we're hoping that that might make it a little more appealing for people. Any questions in regards to that unit?
Can you remind me why the difference there between we have the Child and Youth Services Manager and then the Child and Youth Services Supervisor? Can you just help me understand the distinction there?
So what I would say is, Jessica with the manager really oversees all the programs. So does the grants, does the supervision of the employees, does reporting that needs to happen, and the supervisor does I would say the case supervision. Okay. So really in all the reports that come in, all the open cases, she does that day-to-day oversight. Is that a good summary, Jess? Maybe she's not on it.
Yes, it is. Sorry.
That's okay. Thank you.
I had to find my mute button.
Next, we have our Economic Support Services Unit. We have at this time 2 vacant positions and are advertising to fill one. We really are looking at that second one and making sure that it can be funded through our budget that we have and through the funds that we receive through the Capital Consortium. And so we're kind of sitting on that one for right now. There is some talk in the governor's budget and in the budget for the next 2 years that there may be additional funding there. And if there is, then we will be able to fill both of those positions. And then yeah. 13. Yeah, and this is one as just as a reminder, quite a few years ago, maybe 10 years ago, Richland County agreed to take on 8 additional workers and a lead. Yeah, we were regional and it was cheaper to hire them here than some other county.
I think in the annual report, it mentioned how much, sorry, I'm just going to look back at that because I thought it was interesting because it highlights the consortium's work, or I mean, what we do for the consortium. Let me see if I can find it.
This was a topic that came up many times when we were doing all the budget stuff, because like, why are we here?
Yeah.
Well, we've got 13 here that are working regionally and not just in the county.
Yes. Just going through.
Sorry, I'm like scrolling through. No, I'm just, sorry, there wasn't a question. I was just trying to find the data that they had in this section, which talked about how much we were, aha, here we go. In 2022, as many, this is on page 53, as many as 15,000 individuals were enrolled in Badger Care and Medicare by Richland County Economic Support Specialists in a given month. Of those 15,000 individuals, 4,756 were Richland County residents. So we were only serving about a third, or a little less actually, of our county residents. And I just noticed that because that, like you said, has been a point of discussion and budget discussions and so on. Like, why do we have so many staff in that particular unit? And that kind of highlights how many other resident or counties we're serving. Anyways.
Okay. And then our last is our public health unit, our lowly brandy unit, sometimes we call it. So we are still working to fill those positions. We do have Troy Morris, who's the environmental health consultant. He is an employee of Grant County, and there's 5 counties that share him. This is something that will be changing next year, that they're only going to be able to cover a couple of counties. And so you probably will see some things in our budget related to that position and how are we going to fill those services. There is some discussion of maybe coordinating with Crawford County, but we're really not sure.
Thank you. Yes, Mr. Hochmer.
I was wondering, Trish, did you want to talk a little bit about?
Yes, I would like to hear an update on that.
So this is prior to Clint leaving, and with Angie leaving, we started to have some discussions about having a county maintenance department. Right now there is the custodian here, and then there was Randy Nelson was the head of maintenance for the courthouse. His position has changed to be county maintenance, the head of county maintenance. And so eventually Dennis will transition to the county maintenance department and no longer be an employee of HHS. We will still help fund the position. So we will still have one full-time position in our budget for that, but it will be overseen by the county maintenance department.
So why are we continuing to have one full-time position in our budget then?
Because we're able to draw down additional funds
Oh,
for that. Mhm.
so are we gonna be fully funding it then though, even if it's not under?
No, we're going to continue at the level of what the custodian position was. So Dennis's position is being transitioned into a maintenance technician, so it's a couple of grades higher than where he's at right now. We don't have the funds in our budget to support that, but we will support that custodian grade.
Okay,
Great.
So in the end, we will have 3 positions being one full-time equivalent of a full-time employee, but a percentage of each of their salaries will go back to the Human Services Department budget so that we can keep that reimbursement from the state.
okay, and that's in addition to Randy's position, right?
Randy will be one of the 3. So a portion of Randy's salary will now be taken out of the.
Okay, so we're getting one full-time position.
It's one full-time equivalent split between 3 people.
Okay, thank you, I'm sorry. Thank you.
And that was approved last evening at the committee level, so that will go to the county board on the 20th.
Thank you.
Chair. And Mr. Drake would be able to be utilized in your building, correct?
Correct, yes, yes. Between all 3 of those positions, they will be between the 2 buildings. Yeah.
It kind of was in our vision, Madam Chair, when we did the strategic planning.
It was,
Yeah.
but it's only servicing this building and Health and Human Services at this time?
I think for right at this moment, that's the plan. I think there is hope to possibly expand that depending on
Okay,
everything that happens.
thank you. All right, I think that ends number 18. So, and I've been notified Mr. Gotchel's back online, so we're going to go back then to number 12, approve request for proposals for the provision of meals for the senior nutrition program.
So what I would.
Yes,
I'm sorry.
please, thank you.
Just ready to jump in. All right, so what I would like to start with is some of the handouts that are in the binder, and I just want to get a little bit of an overview to the committee of the senior nutrition program. So our first handout is the number of different consumers. So that's a question that's been brought up a couple of different times, is how many people are we actually serving? So we know how many meals, or we've shared that, but as far as number of people. So thus far in 2023, and this is just in the first quarter, we served meals to 210 different residents. I would assume that the majority of them are Richland County residents, but if somebody from another state or county comes to our congregate program and they are age 60 or older, we do serve them. So it is federal funds, so we can serve anybody through our program. So you can see here a little bit of our history related to the number of people that we have served. One thing that I do want to make note of, due to budgetary constraints, we are not able to serve everyone in the county a hot meal. Some people only have the option of receiving a frozen meal because we don't have the bandwidth to do the deliveries and do the hot meals to everybody that needs one. And just as a note, 30% of the population is eligible for a meal through the senior nutrition program.
Can I ask on this one?
Yeah.
So I know we had kind of taken a hit with COVID, but I guess I'm surprised to see it decrease that much in 2023. Is that due to like our not being able to, handle the amount of consumers, or is it?
I think, and this is just based off of my history from Vernon County, in the winter months, not a lot of people come to the congregate sites. Come the summer and the fall.
Oh, I
we
see.
get
This
more
is
people.
cumulative. I'm sorry.
Yeah.
So this is obviously,
Yeah,
we're in
yes,
2023.
yeah.
Sorry.
That's okay, yeah. So I do predict that that will jump and be pretty stable to all the other numbers, but we've had a lot
Yeah,
of
we're
people
only
that.
in June.
Yeah, and this is only through March. This
Right.
is only the first quarter.
Okay, I'm
Yeah.
sorry, that was.
That's all right.
Madam Chair, if I could just for a second, I can't speak to the national trends, but I can tell you that in the state of Wisconsin, the trends are going down for congregate meals. It's just something that's happening all over. It's not just Richland Center. It's a trend all over in the state.
But this is not just specific to congregate, right? Does this
This
include
is congregate and home delivered.
and home delivery?
Yep.
Okay,
Yep, so this is anybody that is served through our senior nutrition program.
okay,
Okay.
thank you. If I would have read the graphics more
That's
clearly.
okay.
Last question.
Yeah. So then our next one is the meals provided over a 10-year span. So these are just the numbers. As you can see, you know, they did drop in 2020. That was the COVID year. We just haven't rebounded yet. In 2022, we did go back up to the 2020 numbers. We did have a pretty significant drop in 2021. During that time, the congregate sites still were not open. COVID was still going on, but people were seeming to find other ways to get their needs met and not through the sites. We also think people weren't necessarily wanting the frozen meals and the grab and goes. And so they were just finding other options. Any questions there real quick? So then I wanted to share with you what the per meal cost for just the meal, not to run the program, but the per meal cost over the 10-year span, and just wanted to make sure that you saw that the trend has been going up, and we all know that costs are increasing everywhere. Our next one is the 2022 nutrition program revenues. So I just wanted you guys to be able to see the breakdown of how this program is funded. The majority of our funds are received from GWAR. They're the Greater Wisconsin Agency on Aging Resources. We do have MCO revenue that has been dropping over the last few years, and you'll be able to see that in the next slide.
I actually had a question on that. So
Yeah.
I saw that reference somewhere else where it actually said what MCO stood for.
Managed care organization.
So I was curious about that. Does that mean like an assisted living or?
No, so it's the Inclusa, Iris, or family, it's the family care or Iris programs. So for an individual who is, has needs to have additional support in the community, and the goal is really in those programs to keep them in the community, they contract with us and they buy meals, and then we deliver them to people in their homes.
Okay.
Other questions, Cindy?
That was it. What was in?
Okay, sorry.
Yeah. So those two pieces of the pie, so you get funding for that. But what does it mean when you say expected? Like you have a certain number that you expect every year?
I think that's money that.
Still waiting on our
Roxanne,
Okay.
Roxanne, you need.
Sorry.
Sorry about that. When we made this chart, that was before we had received all of our revenues. So that was the amount we were still waiting on from GWAR.
I see a large piece of it is orange and classified other. Could you elaborate on other?
Is that tax levy? I was also confused by that.
Red, orange.
Okay, so I think the last dot is actually an error. I don't think that should be there. Other is really short. It's just the 12210. And so that could be from,
That actually was from the usage of our credit card. We got a small amount of cash back. So, and then the other one, the orange one, is our tax levy. So if you look at what that's what our tax levy is.
I have a question on the tax levy. And is that going to be reduced in the requirement to reduce the budget for the county?
Yeah, I'll let Trish.
so we actually through our 5-year plan did increase the amount of tax levy over the next 5 years. This is probably the lowest the tax levy has ever been for this program, but over the last couple of years, because of COVID, we received ARPA funds to help supplement the program. And so our tax levy decreased and our ARPA funds went up. So we do have plans through our HHS budget and when we did the long range planning to increase the amount of levy in the program.
That number is included in the long range plan.
Yes.
Yeah.
Yes.
And just to clarify for those that are here, the ARPA funds run out. Those are not
correct.
continuing.
Correct. Correct. And one thing I just want to note is just to kind of give you some levy comparisons with other counties and how much levy they put in. This year, Vernon County put 211,000. Crawford was about 106,000. That sound right? 180,000. I'm sorry, I didn't think that was right. And Burnett County was 147,000. So we really just wanted to give you some ideas on how much lower the amount of levy Richland County is in comparison to other counties. And then the next two handouts really is just, yeah.
May I ask, why do we have a lower levy? What causes this? Population or?
I think it's just decisions made by the county board. I think that's just what has been decided over the years of how much levy can be attributed to this program.
Administrator Hilkemer?
Yeah, so the levy is the amount of tax for all county programs, all county departments, that we don't get other grants, other fees, other revenue from the state, shared revenue, ARPA funds, whatever it might be. All the rest of that is made up with levy, and the state puts on limits as to how much the county can spend. So not just this county, all 72 counties. So the counties really have to prioritize. So through past budget decisions, that's how it was determined what the levy would be here. But Human Services, very valuable department, is only one piece of the big pie.
The reason I ask is I'm from Henrietta Township, and they kept their taxes low. And when they set these things into place, we got messed over because, we had lower taxes, so we got less money. Those that charged more got more money, so we're kind of the poor sister, which seems to me what we're ending up paying here too. Thank you.
Madam Chair, sometime in 2017-18 budget cycle is when funding for senior nutrition kind of went down, if I remember that discussion. And I don't know exactly what the whole topic was at that time. Yeah. So, and that was back when Dr. Myers was the chair of the Health and Human Services Board.
Yeah. On my timer, right at the beginning of
Right at the beginning of your time. So Carrie's right. And that was due to the fiscal situation of the county. So every department was looked at, once again, mandated versus non-mandated, and where can you make cuts? That is back when we also closed the Viola Meal site as well, because participation was so low. So it was pretty much tax levy covering all of that cost. And then we lost a large part of our tax levy. So then we had to make further cuts within the program.
So the next handout is just the trends of our nutrition program, kind of where the money has come from, where our budgets have ended up at the end of the year. And so that's just an overview of the program since 2013. And then the next sheet just really breaks that down by the dollar amount so that you can see them in a different format.
So I did have a question on that one
Yeah.
because it looks like last year we had more expenses than our total funding.
Yeah, so we just used levy that wasn't used in other units to cover the rest of the program.
But that was, if I'm looking back, that was unusual because most years it looks like, well, there are a couple here and there.
Yeah.
How do we feel like it's falling this year?
This year so far so good, right? That we're looking at.
I apologize.
So right now it looks good, but as you know, we're only part way into the year. We haven't had a 3 payroll month. Expenses continue to go up. So right now we're a couple % underutilized from what our budget is. I expect that though to not be the case at the end of the year. Some things that have factored into as far as our funding goes, our ARPA funds are gone. So we don't have anything to fill those gaps that we've been really lucky to have over the last couple of years. So we're really watching things very closely, being very particular on expenses that we have to make sure that the only things that we are purchasing or doing is exactly what we need. So there's always those needs in the program that come up that we just aren't going to know right now. But right now we're trending well, but we don't know what that'll look like as the year goes on.
Yes, thank you.
So I wanted to do that as that was an ask of me, was to provide some history, some background, some information in regards to the nutrition program. Now to get to the issue at hand. Since I got here, there's been discussion in regards to the nutrition program and the meals that are going to be provided and how they're going to be provided and how we are going to ensure that the seniors are receiving their meals. The conversation started when Angie retired last year from Richland County Food Service. And we had a meeting at Pine Valley to talk about, would that be an option? At that time, it really wasn't going to be an option for them due to staffing issues, due to space issues. And so I believe then the decision was made, and I could be speaking out of turn here, but they then hired Stephanie and things continued and remained there. With all of the uncertainty with the campus, and I think everybody said today, we don't really know what's going to happen there. We have to look at a way that we can ensure that we have a provider of the meals. We are mandated to provide meals. We have a contract with the state, and even if we didn't sign the contract, we still have a mandate to provide meals to the seniors in our community through the congregate program and through our home delivered meal program. That is a non-negotiable that we have. That is a mandate that every single county has throughout the state. I am trying to be proactive and not reactive and really looking at the big picture of things. And so we made the determination to do RFPs. I do want to give a little background in regards to that. That is something that we are mandated to do every 5 years. The last time we did that was in 2013. And so it was important that we went through the RFP process to get bids, to look at who are the options in our community. When we went through the RFP process, we reached out to many, many different providers, individuals in the community to see if they would be interested. One of the things that I did do was I talked with Jeff Green from Summit Foods. They are the provider of the meals for the jail. So that is something that comes up quite a bit is, do we want to talk about having one provider for all the meals for all the county? I did chat with him about it. I did talk with him. He did not know if they would have the bandwidth to provide meals. I gave him all the RFP information and we never received a bid from them. So I did take that as they're unable to do this. He did state that with their kitchen, he didn't know if they'd have the space to provide all the extra meals that we would be asking for. In the end, we received 2 bids. As you know, we had voted a couple of months ago in regards to this. Then it was brought to my attention that I had made an error through the process. We had requested sealed bids and they were opened up prior to the meeting. And so that was a mistake that I made. And so the process started again. The previous vote that was taken is null and void from this committee because it wasn't a correct process. And we started the process over again. I did consult with our corporation counsel. I also consulted with Jean Lynch from GWAR, who oversees the contract, and that's who we consult with when we have questions in regards to the nutrition program. We did make a request for new RFPs. In the RFPs, it stated that they would be reviewed at the COAD and Nutrition Advisory Committee meeting, and that did happen yesterday. One of the things that we did offer to people is if they wanted to submit the exact same bid that they were able to do that. And so that is why we did not request sealed bids. The county has no mandate on how this process should work. It's my understanding that that's something that's in the works. And as long as the contract is under $150,000, GWAR also does not mandate that the bids be sealed. And so the decision was made to request bids and that they would be reviewed at that meeting. And so yesterday at the meeting, the bid information was shared with the committee and there was discussion. The COAD board voted to go with Mazo Catering. The Nutrition Advisory Committee was a tie. One person voted to go with Mazo, the other one voted to go with the Richland County Food Service. So I'm just passing that information on. Just as a reminder, they are advisory committees. They're not policy-making committees. Our recommendation from HHS is that we go with Mazo Catering. It is really important that we honor the contracts that we have with GWAR. who they funnel it down through the state. And it's very important that we make sure that we have a provider. We don't know what's going to happen to the campus. We don't know what's going to happen with Richland County Food Services. When I started in my very first day here, I attended a finance and personnel meeting, and that was the start of the discussions about what happens to the budget, what happens to the county, that we are in really bad shape, and that there needed to be plans made long-term to make sure that we could continue to provide the services that needed to be provided. That was my first day. And so I've heard a lot of things that are going on. I've heard the mandates that are out there. HHS veterans had the ask of over $1 million in cuts. One of the things that I have to do in the next 5 years is cut 5 positions. And so no department went untouched through this process. But where I'm at right now is I need to make sure that I have a provider of my meals and that we can have a stable provider to get the meals to our seniors in our community. We have received a backup plan from Mazo Catering, and so that was one of the issues that was brought up in public comment. I do want to let you know that we do have that plan. There was some discussion that Sauk County is unhappy with the menus that are provided by Cisco. I just want to provide some clarification in regards to that. The menus are written by Mazo Catering. So Mazo Catering does the Sauk County meals. The menus are written by Mazo Catering. Cisco then reviews the menus for the nutritional content. They are struggling with that process because it takes a long time for Cisco to get the nutritional analysis of the menus back to them. We have had some discussions with Sauk County and have indicated that if we choose Mazo Catering, we can coordinate with them and they could contract with us, that we could then do the nutritional analysis of the menus, and that would be a little bit of additional revenue for us in regards to the program. Yes, I will leave it open to questions at this point in time then. Ms. Chicker?
Do you have staff who can do that nutritional analysis already?
Yes.
On staff, and wouldn't be too much extra work for them? Because I know from having the dietary department report to me that it is quite a tedious job.
Yes, Tanya Webster currently does that for our menus, and she would be able to continue to do that. And she has been approved by the state to be able to do that. So she has the right qualifications per GWAR.
And she is a nutrition specialist, correct?
Yeah. Yeah, we're not sure of her exact degree, but we do know that she's qualified. And I have Jean Lynch from GWAR on, and so they have approved her to be the person that can do that.
Yes, great.
Other questions? Oh, okay, Mr. Hookmer.
If I could, and I just received notice that our first county administrator candidate is here, so I'm going to have to step out of the meeting. But I say this in all sincerity, and I don't think I have to tell you this, but I'm going to say it anyhow. And this is coming from someone who's personally been involved with human services and a member of the Dane County Area Agency for over 25 years. The number one thing that the Human Services Department has to do, should do, is be an advocate for the people that they serve. Whether it's the seniors, whether it's mental health, whether it's foster care, whatever it might be. I will say that there's 3 things that we need to do: advocate, advocate, and advocate. And there's parameters that we all have that we have to live by. There's budgets that we have to live by. But I think that the decision of the department to make this recommendation, and ultimately the decision of this body, is to remember that your goal is to be an advocate for the people that you serve. And in the conversations that I've had with Trish, I believe that that's what the department has done. And I would ask that you keep that in mind. You have to be an advocate for those that you serve. We don't always have easy decisions to make, but we have to be that advocate. Thank you.
Thank you. Mr. Van Landyck?
There are several things I think here at issue. First off, with the budget deficits that we have in this county, Tricia was told to reduce the amount of money being spent, and she's done a good job with that. One of the last things we're dealing with right now is the issue at hand. And I think that, you know, from all the talks back and forth between this one or that one, we need to get to the discussion portion of this. So I'd like to be the devil's advocate and say that I would make the motion that we go along with the Richland Food Service as we have for the last number of years. So that's my motion.
Thank you, and I will entertain a second, although I do just want to clarify at a committee level, we don't have to have a motion and a second to be able to discuss. But I will take a second if someone would like to do that.
Take that a second.
Thank you, Mr. Braithwaite.
Okay, if I may continue then, it's not our decision. We're simply going to make a recommendation to the entire board. And they're the ones that are going to make the final decision. And I've had a chance to speak with a number of board members, people here in this room now, and others along the way. I stopped in and I talked with two providers, Stephanie Derry and Cindy Deidelhoff. And I had a chance to go to the meal site at the senior center, and I spoke with the people there yesterday and asked them what their opinion was and things, and they seem to be pretty happy. And the thing that they were concerned with is that we're taking money out of this community, the 50,000 plus, and we're going to send it elsewhere. If we pay the people here, the money stays here. If we pay the people there, it's gone. So we don't have a second or third chance at having the money spent in this community. Delivery from Mazomanie would be an hour, and they talked about soggy food. I've had soggy food. I wasn't in the Marines, but I've enjoyed that. Air Force does that too. Also SOS in the mornings. Anyways, I think that we'd be doing ourselves a great favor by going along with our people. I mean, they've been good. They've been here for all the years except for one. And I think the things that Barb and Linda had to say were correct. There's progress being made on the front with the university. They've given us the furniture. They've given us the place. They're going to keep the lights on. The janitorial staff is there. Everything's there. And there are things being worked on right now. And I think to shut ourselves off from that possibility locally would be a mistake. So we're kind of looking to the future, and I'd like to keep the money in this community. These people that have been served by our people here have been fairly happy. There's been complaints. I mean, everybody in this room doesn't have the same taste. I mean, there's some stuff I'd not want to eat and some stuff that you'd love. So, I mean, there's always going to be people that aren't going to be real happy with things. My wife was a home ec teacher. And if you've ever tried to make something without salt in it, it doesn't taste good even if you add salt. And they're required to keep salt out of their diet because some of the people cannot have salt. So, I mean, there's a number of things that we need to deal with here. And I think that we don't make the decision, but they will. So this is the reason I wanted to make sure that, you know, to all due respect to Larry and the others that were on the nutrition committee, I think they came up with the best decision they could, and I think we should maybe counter that and let the county board discuss it, and then it's in their lap and not ours. So I would very much like to see my comrades here vote to keep our food service in this county. Thank you.
Mr. Barris, or Dr. Barris?
Well, first of all, I would like to say that I think you guys were stuck between a rock and a hard place making this decision, and you probably made it to ensure the most likely continued without any disruption in the food service. So I can see why you made that recommendation, and I think the only reason we're not going with the county food service is based on uncertainty. Is that correct? Not because of unhappy customers?
So the two primary reasons, it's uncertainty. We don't know what's going to happen with the campus, and we don't know what's going to happen with Richland County Food Service. But my other concern is that historically, and I have data back from 2018 to 2022, the Richland County Food Service loses money every year. I would say around 40,000 a year, and tax levy has to be used to make up that difference. We are in a time now with this county that we have to make cuts. We have to. And we have to start looking at what is mandatory, what's not mandatory, and looking at that big picture. And so that is a big part of it is I'm not certain that the county board will continue to keep this program going because it is something that's losing money every year.
Well, from what I saw from the Mazel proposal, it appeared that their price per meal was higher.
Yeah, so the price per meal for the Mazo is higher, but there will be some other cost savings that are in place. So number one, we will have less staff, so they will be providing the meals for Germantown, so we won't need to hire a cook for Germantown anymore. We also have those food costs, so we won't have that. So when we look at that, that is a wash there. We will have less time that will be used to deliver the meals because the meals will be delivered. But ultimately for the county, going with Mazo Catering will cost less money than staying with Richland County Food Services.
We know that for 1 year.
Excuse me?
That's for the 1 year. Did they give a 3-year estimate or 1 year?
He gave us a bid for, it'll be through the end of 2024. So and I didn't share that, so I apologize. The bid for Mazo Catering is $6.25 per meal, and their frozen meals are $6, and the Richland County Food Service is $6 a meal.
I mean, I think the Richland County Food Service has done everything they could to reassure us that they would be stable. I don't know what else we could ask from them to do. Backing of the county board. And I can realize where you're coming from, but I think us as a HHS committee also have a commitment to the community. And it goes beyond just the meals. I think that in recommendations in the past, one of the focuses was to improve relationships between HHS and the community. And I think the community looking on us as to farming out a contract to a different county without overwhelming reasons otherwise would not be supporting our relationship with the county members, especially with a lot of the community leaders here that are in high support of continuing with the county's food service. I think that we would be taking a step backwards as far as our relationship with the county if we do that. So I support Mr. Van Light's proposal.
Thank you. May I speak again?
I would like to give other people a chance to speak, so, and then we can come back.
Thank you, Doctor.
And that includes those online. Yes. Anybody from online or in the room want to speak?
Yes, I would like to speak, but I would defer to Mr. Van Dyke's request to rebut first.
I don't think it was a rebuttal, but thank you. Why don't you share what you had, Mr. Steep, and then we'll move on.
I have great respect for Angle and for the other speakers here. And I certainly respect the professionalism of the staff in their multiple levels of work and research in coming forth with this proposal. My concern primarily is that I think it's a very good point that we are sending money out of the county instead of keeping it here in the county. Secondly, I have, as one of the speakers said, our mission is to be an advocate for the community and especially for the clients of the nutrition program. I tend to want to also be an advocate for employees who may not continue their employment through no fault of their own. And the loss of a job is often devastating and very hurtful for an employee. I would hope that if this program proposal is approved, that some assurance is given that every effort will be made to look for alternate job opportunities, as Mr. Rennis so intelligently suggested, other job opportunities within the county. I think that it's only a question of fairness. These have been, one of them in particular has been an employee for a longer term. Both of them have done an excellent job. They're making every effort to advocate for and serve the clients of the county. So I also am concerned about the issue that was raised regarding the food losing its palatability because of 4 hours of travel and not maintaining a constant heat. I think that is something that will bring about some complaints. Further, I was very surprised to hear that the hot food that is prepared on site at Germantown, if I understand it correctly, will no longer be done, that it will be provided by the folks from Mazamini. Now, maybe I misunderstood that, and maybe they're just talking about the lunches that are delivered, the home meals that are delivered. But I know that there would be tremendous dissatisfaction with the nutrition program if they did away with the employment of a person to prepare hot meals on site. That has been a tremendously successful program. And not only that, it has been economically positive. They've taken in more money than they've spent, and their donations have been very high. And it is a very, very, I would say, happy community because of the service that's provided them through the nutrition program. So there are questions and concerns, and I know that everyone has a good intention. Their goal is to serve the very best interests of the county, and that includes our employees, who are, in the final analysis, the greatest resource we have in the county, our employees. And we struggle to retain, to recruit and retain good employees. And we must be careful not to adversely affect their livelihood and to adversely affect the quality of employees that we have in the county. Morale is an extremely important issue, and this is also a morale issue that the word gets around. So let's be careful with this.
Thank you, Mr. Steep. I think Ms. Clements wanted to address a couple of your comments that you raised.
Oh, you're going to rebut.
If you want to call it that.
So in regards to Germantown, right now there is a hired individual to cook the meals.
Yes.
She is retiring and no longer able to do the meals or no longer wanting to do the meals. So we do have to have these meals be provided by whoever our provider is.
Is there a possibility that that someone will be found to replace that position?
We don't think so. And our plan is not to try to hire another cook, but our plan is to look to have whoever is our meal provider provide the meals for that community.
Trish, I'm not quite satisfied with that approach, but that's your decision, I guess.
And, you know, I guess I'm going to say, and I've got Tom Rislow in here, it's very difficult to hire cooks. He's struggling to hire cooks right now. It isn't an easy task, and we need to have that continuity of services. And so we do have to look at another option outside of hiring somebody. If they came to us tomorrow and said, hey, we've got somebody that can come and cook meals for you, we most definitely would look into that. But we need to look at being able to continue to provide the continuous services for the community. Number two, go ahead.
I understand that, Trish. Thank you.
The second concern that's been brought up a couple of times is the quality of food by Mazo Catering with the delivery time. When we went down and met with him down in Mazomania at his place, he talked about doing catering events in Stevens Point, in La Crosse, in Madison. He has shared that he has no concerns with maintaining the high quality of food with the distance that it and the time it'll take to get it to us. And we have received references from Sauk County that the food has been fabulous. We've received other references, and he did provide in his RFP a full page list of references. And so I guess at this point in time, I don't have concerns with the quality of food that will come from Mazo Catering.
Thank you, Ms. Clements. I would also like to attempt to address, I think a couple of times the question has come up about why are we sending money out of the county? And so I may be stating this incorrectly, and this is not to address the other issues, the stability or anything like that. And I'm not necessarily advocating, I just want to clear that up because I feel like that's a misconception and perhaps I'm misunderstanding it. So please correct me, anybody who's better educated than I am. But for the campus or the Richland County Food Service, we as a county have to provide a budget for them to keep them open. And as Ms. Clements has stated, in the last few years, due to many reasons, particularly declining student population and so on, they have not been able to make money, which then means that the county is then covering a certain amount of their budget that's not being covered by revenue. So then we are also contracting with them and sending money towards that food service program, which includes a portion of county levy. So if you look at it that way, we are essentially paying them to stay open as well as also paying them with county levy to provide these food services. Now, I hear all of the arguments of wanting to keep something in the county and wanting to make sure that we're funneling money into the county. But if you look at it that way, we could actually be costing other programs and other services and other people in the county by having to cover those costs with county levy, that if we contract elsewhere, we are not having to cover the cost of the actual program itself, if that makes sense.
I
Ms.
generally,
Gentis.
Thank you, Ingrid. I'm sorry,
I'm sorry, I'm gonna let Mr. or Ms. Rudersdorf speak, then Mr. Steep, and then Ms. Gentis is here from the Education Committee and can speak. Ms.
thank you.
Rudersdorf?
I will be very short. Yes, Ingrid, you are absolutely correct. And yes, we have, speaking from the Nutrition Advisory Council, the food service, yeah, we have essentially been paying them or paying to keep the nutrition going. And we really need to be thinking about who we're serving. We need to be putting people over property, essentially. I know we all care very much about the campus, but we have to think about our seniors and who we're providing for. And that's really all I have to say. Don, go ahead.
yes, thank you. I appreciate generally the tradition of a chair being rather neutral and stepping aside from the chair to make an argument, but I'll let it pass.
So again, I just wanted to say, I'm not commenting on the benefits one way or the other. I just wanted to clear up, to state what I believe is a misconception as far as the county money is going. So I did not mean that to be an intended support of one way or the other, just a clarification.
I must say it came across that way.
Can I speak?
We're still in debate yet over a motion,
Okay.
so I think the chair has got a right to say what she wants to while debating a motion.
Traditionally, we expect neutrality from the chair.
You were fine, Madam Chair.
It was a clarification, and I would like to say, yes, that was a very great clarification. Thank you, Ingrid. I appreciate it.
Gentis.
I agree that it was a clarification. I'm glad you brought it up.
Okay.
Since 2018, as some of you know, UW Platteville removed, we had 3 bases for the Richland County Food Service. It was the summer programs, which was the #1 thing that kept it going. The nutrition program was second, and third was any students and other things like that. 2018, Platteville removed all the summer programs. So that was a basic thing. Then we got COVID hit. So those are true that we had that. When Stephanie Derry was hired, I met with her and I said, this cannot last. I'm on the county board. I understand that we cannot do this. She was told she had to get things in order or else it would not be. I would not be here today to support her. And I double checked figures this morning and since January, which she was hired in October, and she started to get things going in December because we had to, since January, every month we have been in the black. So the county will not be paying extra money toward that unless something drastically changes. So it was in the past, but that would not be true for what you just clarified now since January. So I just wanted to make that clarification. Thank you very much, though, for bringing that up.
Okay, thank you. Yes, before you step away, Mr. Severson has a question for you.
When you talk about the food service being in the black, is that her, or is that department bringing in revenue above and beyond what she was budgeted for being in the black? Or is it underspending her budget that's resulting in her staying above or in the black?
That's a good question. I'm not sure I can answer that totally. The revenue coming in is higher than the expenses. And we have a different budget than what was budgeted because Angie left and she was at a higher salary. So we're not exactly on the same budget as what was presented for the whole year last year. So it's hard to get exactly how much that difference is on that. And she's at a lower salary and a lower, other things. I can't think of what the word is, fringe benefits and things like that. So that's why it's a different than the actual budget.
I have a question, Supervisor Gentis. It's the same thing as Carrie's asking. If they're going to be in the black, where is the increased revenue coming from? That's the simple way to answer the question.
Okay, yeah.
Where's the increased revenue? Is there more people going to the campus? Is there elderly going out there to eat? I mean, what?
Right, they're in the black because one of the major things was that the purchasing was not being done in coordination correctly with what was going out. There was too much purchasing happening. So we looked at all those items and especially what was going to the food service and the nutrition program. And I guess because in the past, there'd been so many other things, they just continued ordering and doing that. So we lowered all those costs. So revenue that was the major thing right there. You got to figure out why you keep purchasing certain items, why you keep having certain things going. Even the soda fountain, we don't need the soda fountain, things like that so we had to lower all those costs. The other thing is the Superama, the take and bake meals, the community is starting to come there more. We have, a lot of people that work out there that eat there. As you know, the extension program is going to be moving there. Their Head Start has made a comment to me that they would like to come there and they have a need for meals. So we see even more potential, but right now is all the basic stuff that is just good management is making it better. Does that help you?
Yes and no.
Okay.
Revenues are not going up. That's the question.
Revenues have gone up some. They haven't gone up.
They are not going up. Revenues are not going up.
No, I didn't say they're not going up. They're going up some, but not dramatically. We have just started a program with the housing approach across the street. We've redone all the menus in Spanish, and that has just been put up there. So there's a lot of initiatives that we're working on. I don't want to mislead you in some way.
No, I've got a good
Dr.
idea
Harris?
what's going on.
Can
I speak?
just explain something that hasn't making sense to me? If we're not sending money out of the county and we're losing, actually supporting it and losing money, and Mazo is a for-profit business, they're gonna do it cheaper and maintain the quality. How are they gonna make money?
I don't know if you can respond to that, Dr.
Really
Green.
answer that question.
I mean, yeah, that's,
Yeah, so they had provided to us in the bids, and we can get those passed out. But on the second side of theirs, they did give us their per meal breakdown cost, and they showed per meal how they're going to, where their expenses are going to. And so it does show that they are making a profit. That is something we did ask of the Richland Center Food Service, and we did not see that. Because when I came from Vernon County, that's one of the things that we always looked at is when bids were received, are they able to maintain that long term? And so that was something that was shared with us with Mazo Catering to show that they have given us a breakdown of where things are at. Their meals are more expensive, but as the program as a whole, we will have less expenses because we will be able to, number one, if we'd go with Mazo, work with Sauk County and have a contract there. And then we are going to have less staff time because we won't have the full-time, or not the full-time, the cook at Germantown. And the person who does help with the cooking will be working less hours.
does that answer your question, Dr. Gross?
I guess it does. I just don't foresee that we're saving that much money that it's gonna be profitable for Mazo to take on a contract like that. Like this. To me, it doesn't seem like it's making economic sense.
Yes. My biggest concern, and I'm gonna stay right up front, I'm for Mazo Catering because we, as a county board, I sit on the board and I'm at a loss of what's gonna happen. There's a lot of talk about what's gonna happen, but we as board members have not seen one contract, not one memorandum of understanding of what's gonna happen out of the campus. So with the information that we have right now, the only decision, when we're not between a rock and a hard place, the only decision we can make is Mazo for the advocacy of the people that are eating the meals. Period. It's the only thing that's guaranteed. There's so many things not guaranteed in the county right now. It's very frustrating. The only thing that's guaranteed right now is we can do Mazo Catering and we'll know we'll have meals. That's it.
What happens January 1 if the county board chooses not to fund fully the Richland County Food Service?
So that's a great question. You know, I looked at this. I would assume come September, October, we'll have an idea if the county will continue to fund the Richland County Food Service. If a decision is made not to fund, we will then have to go through this RFP process again and hope that we can get a provider. I don't know if Mesa will bid again. I have no idea, but I do know that we've reached out to multiple other entities to see if they would bid. We reached out to Summit Foods, Phoenix Center, Richland Hospital, Pine Valley, Honkers. Those are all places that we reached out to see if they would be interested in providing the meals. They all said no, that they don't have an interest in doing that or haven't responded. I don't know what's going to happen if that happens, and that's what my worry is. I know from my perspective, if I found out in October that come January, I'm not going to have a job, I'm going to be looking for another job come October, and I'm going to take the job that comes across at that point in time. And that's my other concern. And maybe I'm having way too many worries of things that may or may not happen. That's my job as a department head. My job is to make sure that my programs are being met and that I'm in compliance with my contracts. And so I do worry that the county is going to make the decision not to fund it beyond the end of this year, and then I'm left with nobody. We have an obligation to provide meals. We then might be in a position where let's say we've connected with Crawford County and they have said, yeah, we could maybe make your meals. They're talking $9+ an hour. We're looking at 6.25 right now. We've talked to a Quick Trip and they could try to throw some stuff together, but if we're not in full compliance of our nutritional requirements that we have to meet, we cannot use GUAR funding and we have to use our other funding sources. And so that won't last very long. And so I am very worried about what is going to happen if the county decides not to continue to fund the program.
Mr. Van Landijk.
Thank you. I would suggest we're here in the moment, and December is December and January is January. I think we might be looking too far ahead at this point. There's been several things. Sean Murphy Lopez brought a chart to the last couple meetings that we had with Senator Mark Lang and the other Republican representatives. And he showed the university and the amount of money that, you know, has been taken from us by the government, by Platteville, by kind of stripping us of everything along the way. I mean, we've just been the tail end of the dog when it comes to all of these things. And we're dealing with the dregs of what goes on because of things at the state level, things at the university level. Platteville really did us a disservice the last couple of years. I was on the education committee with Linda. And like I said before, I mean, they did nothing but give us lip service. They did not come through with anything. And the thing that I like about staying with the people we have right now is the fact they're local. We talked about money staying in this area. We talked at the last meeting about maybe increasing, putting people up on the pay scale to keep the good people we had, which is talked about. And I think we need to look positively at this thing. I mean, we can always look down, but I prefer to look up to see what the possibilities are. We have local resources. If in fact we cannot provide it here, you know, if somehow the building should shut down, we can go to the hospital. I mean, we have alternative sites, whereas the Mazomania said that they had no alternatives. So, I mean, we've got something here available, and we've got, you know, the resources within this community and enough community interest where I think things would work themselves out. So you were going to say?
Yeah, two things. Number one, we don't have a backup. So if the campus and the food service closes, the hospital has said they would do it short term. We asked them to bid and they're not open to bidding.
Oh, I'm not talking about that. I was just saying if for some reason the campus should shut down, they've got other sources of food and other places where people could meet, or the community center. This is the way I understood it.
And
correct, Linda?
a location is not our issue. It's who's going to provide the meals and who's going to provide the meals that, meet the mandatory nutritional requirements. So we can't just say, here's $5, please go to McDonald's and buy a meal, or go to the hospital and buy a meal. We have to have nutritional requirements that we have to meet. And so we need a provider to agree to make those meals. So even at Pine Valley, what they have to make for their people is different than what we have to make for our senior nutrition people.
Right. And one of the other things I've been following Mark Klein is his news little blurbs all the time. And he's very happy with cutting and cutting and cutting. I mean, if you've read anything he said, I mean, this is where we're at. They want to privatize everything, and they want to, you know, I think they're just stealing our jobs. So I would call the question, and I'd like to have a voice vote, please.
Okay, I'm going to let Ms. Chicker speak, though. You had your hand up. Did you want to speak?
Yes, I know I can appreciate everybody's positions here, because at one point in time, the hospital did do the meals, not only for the home delivered meals, et cetera, but also for the jail meals, and for several reasons, one of which was definitely budgetary. We couldn't do that any longer from a fiscally responsible standpoint, regardless of the feel-good nature of it all. Likewise, the same thing happened when and there were lots of discussions that took place, and I was at an administrative level on the group making the decisions to close down the home healthcare agency that we had, to close down the hospice services that we provided. Again, all heartstring type things provided locally by local staff. And then again, when we had to close the daycare center, and oh my gosh, I thought the world was going to come to an end for some people. People who weren't using those services were upset that we were closing those services. It's a hard decision to make, but in the end, we had to do what was fiscally responsible for the people that we had a mission to serve, the community of Richland County and the other counties that we served. So we did have to make those difficult decisions, and this is one of them too. We have to be fiscally responsible, yet serve the core group of people that we are required, mandated to serve. And I would agree, it's probably time to call for a vote, but regardless of the outcome, it's going to be a difficult one.
Thank you, Ms. Chicker. I do last want to give a chance to those who haven't spoken yet. So Francis, Sherry, and I think Tim, do any of you have any comments you want to say before we go to vote? Okay. If we're ready then, I think, Megan, are you able to do a roll call? Yes.
Madam Chair, what is a yes and no vote?
Oh, thank you. So we did have a motion and a second, way back at the beginning of this, to approve the recommendation, which was the approved request for proposal for the provision of meals for the senior nutrition program. This is the first 12A that's in your packet. And so then the recommendation is to approve Mazo Catering as the caterer for the senior nutrition program. So yes would be to recommend that.
I believe the motion, though, was to approve Richland County Food Service by Lee.
Oh, I'm sorry. I misunderstood that. Yeah. Thank you, Tim, for hearing that. I did not. I'm sorry. Thank you all.
That was the motion and seconded.
Can
Yes, so the
The vote for
motion,
vote.
yeah, the motion would be to approve Richland County Food Service. So a yay vote would be approving Richland County Food Service. A no would be obviously not approving Richland County Food Service.
Thank you for clarifying.
That contract.
Ms. Chair, point of order. Say, for example, this is not successful, then we haven't approved Mazo.
That's correct. We'd have to take another vote to approve Mazo. And I apologize. I did not catch your wording, Mr. Van Lande, or I would have clarified that at that time.
Do we have latitude to call for such a vote with a motion and second after this one procedurally?
We do because it's on our agenda, I believe.
Perfect. Okay.
By the motion that I senior nutrition program, is that correct? Did I use the right terminology?
So I have a motion by Lee Van Landewit, seconded by Francis Brathwaite, to approve the Richland County Food Service as the caterer for the senior nutrition program. Okay. All right, so Carrie Severson? Danielle Rudersdorf?
No.
Ingrid Glassbrenner?
No.
Timothy Gatchell?
No.
Donald Seep?
Aye.
Ken Renish? Dr. Jared Barris? Cindy Chicker? Sherry Hilsheim? Lee Van Landewit?
Yes.
Francis Brathwaite? Okay. We have 5 yeas and 6 nay. So the nays have it.
Okay, so then that takes us to, we would need a motion to recommend approving Mazo Catering as the caterer. Okay, do we have a second? Mr. Severson seconds. I assume we'll want a voice vote for this as well.
Remember to alternate the, don't call me first, because you just did. So alternate around.
Oh, they like you to alternate who starts.
Sounds good. Okay, we have a motion by Ken Renish, seconded by Carrie Severson to approve Mazo Catering as the caterer for senior nutrition program. Okay. Francis Brathwaite? Lee Van Landwaite?
No.
Sherry Hilsheen? Cindy Chickert? Dr. Gerald Barish? Ken Renish? Donald Seat?
No.
Tim Gotchell?
Aye.
Ingrid Glassbrenner?
Yes.
Daniel Rudersdorf?
Aye.
Carrie Severson? Okay. We have 6 yeas and 5 nays. The yeas have it. Motion carried.
So for clarification, this goes on to county board now for county board approval.
It does, but we will also be addressing this again in number 13 because it is one of the contracts that is on that list. I just want to say again, I understand that this has been a very difficult and emotional issue for many people. And as has been stated, everyone on this committee cares deeply about the people that we serve. And I hope that this is not taken as a reflection of a lack of care. Okay, so moving on to number 13, contracts and providers. Would you like to address that, Jamie?
Morning. We have a few contracts to approve. The first one is for Pine Counseling. We are requesting approval to enter into a contract with Pine Counseling to provide psychotherapy services for individuals enrolled in our CCS program and our behavioral health services unit for $25,000. Yep. They're all new. The second one is Music on the Move Music Therapy Services. We are requesting to go into contract with them to provide counseling and therapeutic services for children enrolled in our Children's Long-Term Support / CLTS program for the amount of $10,000. Next contract is for Integrate Children's Therapy, also known as Motivate Children's Therapy. We are requesting to go into contract for them to provide counseling and therapeutic services, empowerment and self-determination supports, and training on living skills, mentoring, and health and wellness services for children enrolled in our CLTS program for the amount of $10,000. The next one is for Dr. Dean Sainer, Doctor of Psychology, to provide psychology consultations for individuals being served in our Behavioral Health Services Unit for the amount of $20,000. The next contract is for Mazo Catering. We are asking to go into contract for them with the amount of $76,800 to provide meals for our nutrition program that will be delivered to Richland Center, Rockbridge, and potentially the Germantown site. And the last one is for the Ellen Adult Family House for the amount of $6,000 to provide respite care for individuals being served in our behavioral services unit.
We are able to do these all as one. That would require a motion to approve these.
Carrie Severson will move for approval.
We have
I'll
Ms.
second.
Severson moving and Ms. Rudersdorf seconding. Right, all those in favor, please say aye.
Chair question.
Yes.
With these contracts, except for a couple of them, actually all of them, except for the Mazo Catering, that has to go to county board, right? So if we approve these contracts right now with, Pine Counseling and Dean Sainer, they're under the dollar threshold. That means that you can start and enter in those contracts with them. However, the $76,800 for Mazo Catering, it's above that.
Yeah, shouldn't they be separate motions then? Because doesn't just the Mazo have to go to the board, or do they all have to?
They've been separate.
I think we used to do like any that were over 50,000 would be a separate motion, and then the ones that were under. So if you guys want to do it that way, there's more than 2 that are under. 2, 3, 4.
I just use those two as an example.
So are you amending your motion? Who made the motion? Or do you want to do it all at once? I mean, I don't think it matters.
Who made the motion?
You did.
You did.
Sure, yeah, I would amend a motion to, have we got 1, 2, 3, 4.
Just take out Mazo Catering.
The way the motion is typically written in the minutes is that the motion is to approve the new 2023 contracts and forward those necessary onto the county board for approval.
So I'd approve
Is that what you would like the motion to be?
Yes.
Okay.
All right.
That's how we typically word it.
Then we're back at vote. So all those in favor, please say aye.
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 Those opposed? But I do think he's right. We had, at least in the past, had them separately, and then we just make two motions. Okay, that brings us then to scheduling our 2024 budget public hearing in July. If I remember correctly, typically we've had that be an evening, I want to say like 5 or
I talked with MIS and they could support it at 6 o'clock that night.
6 o'clock on July, what would that be?
13.
13th?
Yeah, July 13 at 6 o'clock.
Committee members, is that July 13th at 6 p.m. That would still be here, I'm assuming?
Yes.
That is a Thursday. That's just to make it easier for members of the public. Yeah. That reasonable? I mean, there's nothing that says we have to offer it in the evening. We just have traditionally done that so that it gives public an easier opportunity to be present. I will say in the last 5 years I've been, no, 6 years I've been on the board, I'm trying to remember if I've ever seen a member of public at that particular meeting, but we don't, but it's still, I think, a nice thing to do. So, yeah, I think we've done it earlier before, but MIS can do it at 6. Is that okay with everyone? Okay. All right. So we'll say 6 p.m. then on July 13th.
Yes.
Okay. Number 20, future agenda items. I know we had this last time, and I know you and John are still working on that as far as addressing the public health nurse.
We'll put it on.
Okay.
Mm-hmm.
All right. Anyone else have future agenda items that they would like to see be discussed?
Hopefully we can put the chip and chaw on.
Oh, yes. Yeah. Okay. If not, that takes us to adjournment then to that July 13th date. Motion by Mr. Renish, second by Ms. Chicker. All those in favor, please say aye. Aye. Any opposed? All right. Once again, thank you all for being present. We appreciate it.